Thank you all for being here. It's very appreciated that I can be here as well. And I want to talk to the mandates that are existing around COVID-19. I'm a team lead for the Canada Health Alliance, and this is an organization of thousands of health professionals that are wanting to bring forward solid evidence that can help us move away from this stagnant place that we're sitting right now. These mandates are not safe, nor are they effective. And I'm going to give you some information that will help support you to do the right thing and help this community move forward, not only as a free community, but one that is a model for others. There are communities across Canada, there are countries across the world that are looking now at the evidence that has been buried. They're looking now at the evidence that has been silenced, and they're making decisions for the betterment of society, for the betterment of humanity. So the first mandate that I'd like to talk to is the mask mandate. Now, I was recruited to teach at Vancouver University, and one of the courses that I teach is universal precautions in infection control. And with that, I need to teach proper masking to control spread of infections. I was terminated in the second week of September because I read off this box. Now, does anybody have the eyes or the cheaters to do that for me? This is about 3 sentences. Somebody? Up there. And that tells us how effective these masks are.
Okay, so warning, keep away from children and pets. This product is not a toy. Single use only, do not wash.
Oh, sorry.
Sorry, Roger. No, I got it. Is that what you want? Just be afraid of it.
Yeah.
Okay. So, sorry about that, Roger. Whenever I'm talking to somebody at the podium, I'm leaning back. So it reads, this is not a no-wash approved product. This product is not designed for use as protection against biohazards, brackets, bacteria, viruses, asbestos, silica, coffee dust, or any other toxic fumes, mists, gases, and vapors. Not for use in spray paint operation.
So it is not for use, does not protect against transmission of what? Viruses. Why do we have a mandate to wear things that don't protect us against the transmission of viruses? Big question. These things are not worn correctly. The cotton ones are not worn correctly. They're off, they're on, they're off, they're on, they're off, they're on. If you're going to use a mask properly, it needs to be one use only, and then it needs to be disposed of. If this virus was as horrible as stated, there should be bins everywhere that are just overflowing with these, because we would stand with one, so we would take it off, we would dispose of it properly. Every time somebody reuses a mask, anything that they're carrying in their bodies, collecting in, on, around it, it is actually a little bacteria factor or a virus propagation factor. So that's the masks. So they are not helpful. And there's extensive amounts of science to show us that. Then there's the vaccines and the vaccine mandates. And what we're finding is that these vaccines do not prevent the transmission nor getting of these viruses. And if you go to the information that I have included, it came through on the website today. I'm going to give each of the counselors a package that has this information there. You can go through the science. But I don't have much time, so I don't want to spend too much time on the science. What I do want to do is to tell you some stories. So I lost one of my jobs because I gave facts to my students on a course I've taught for many years in the same way I've taught for many years. But it doesn't meet the mandates. I can't get a shot. Even if I wanted to get a shot, that can't happen for me. As soon as these shots came out, I received a letter from St. Paul's Hospital, myself and my children, because we are at risk for myocarditis, which is an inflammation of the heart which could kill us. This is one of the known side effects of these shots. I'm about to lose my entire license to practice now because my exemption that was not solicited, which came from St. Paul's Hospital and my doctor, is not being accepted anymore. So the choice that I'm being given to practice as an occupational therapist, and I've done this for almost 30 years, is to choose to take a shot that has a 30% or more chance of killing me, or to get fired. To not be able to practice, to not be able to serve the people in the capacity which I've trained and done for many, many years. My son, Tyler Leslie, and some of you here know him, did get a shot. As his mother, I am now living in extreme fear that if he gets another shot, and the reason that he got a shot is because he wanted to work. The reason that he got a shot is that he wants to travel. The reason that he got a shot is because he's a good guy, and he was told he needs to do this to protect everybody else. My 19-year-old son, if he gets another shot, maybe in a couple of months, if these shots do what the scientists find that they do, is going to die. Because our government, because these mandates do not support choice. Informed choice. We all need to know that this is an experimental procedure. Everybody who takes one of these shots should be filling out papers and papers and papers of exemption forms saying that they are fully aware that they're participating with an experiment. These trials have not gone forward. I just got this information today. It's not printed out very well, but I'm going to quickly hand it out. And our government is telling the College of Physicians and Surgeons of BC, the College of Pharmacists of BC, the College of Nurses and Midwives, and the CDC are not approving the use of ivermectin for treatment or prophylaxis for COVID-19. This is a treatment that has been used for many, many, many years on humans. This is a treatment that actually won a Nobel Prize for its use in humans. But they're not approving this right now. In fact, they're saying that anybody who attempts to use this as a treatment will face severe disciplinary matters. They're not approving it because there have been no approved randomized controlled trials. Now, can anybody tell me where I would find the randomized controlled trials of these shots that are being mandated? And if we don't take these shots, we lose our jobs. If we don't take these shots, if we have a medical condition, we stand to lose our lives. If we live in certain countries where these shots have been implemented significantly, like Israel and Taiwan, the numbers of deaths from these shots have now surpassed the numbers of deaths from COVID.
I don't want to interrupt you, but you've got about 1 minute.
Okay, so my goal here is to invite every one of you to stand up and do the right thing. We need to stop these mandates now, and you have the opportunity to do that. The city of Powell River is promoting vaccines through a vaccine clinic in the complex. It's promoting it through advertising, through things like the masking sign on the door. These can all be removed. We have the opportunity to do that. I'm going to hand out notice of liability, which you can all read. I'm not doing it to scare you. I'm doing it to help you. Because all of this information is going to come forward. All of this information is going to be in the courts. And I want all of you to be on the right side of the law. So together we can make this a model community, and we can do that now. So those of you who are here, Rob Silcott. Jim Palm. George Doubt. And Carol Ann, she's not here, can I give this to you for her?
Did I get mine already?
You did get yours already, yeah?
Okay, so council, any questions or comments? Councilor Silva.
Thank you, Chair. I was a healthcare provider for 32 years. And I started on my way long before that with a couple of years of science at UBC. So that gave me basically some training to be analytical. When this came out, when it started last year, I took it pretty seriously because I was working in Vancouver during the SARS outbreak of 2003. And I wanted to see what was really happening. And for a while, I saw pretty bona fide investigation of what was happening. And then I saw exactly what we were all told about back at least 5 years ago. And that is what's happening with data and science in our society. So to cut to the chase, in my view, where we're at right now is a point where data is entirely mixed up and confused. There's some that is probably right. There's some that's probably completely wrong, and there's a huge amount between those two extremes. And as time goes on, it all changes. Even what we know is changing and growing very quickly. So to use science as an argument point is powerless, in my view, anymore. And data, basically, the only thing I know for sure is that it can be manipulated so badly that I can't analyze what I trust or not. So it's not trustworthy. So I have one point to make, basically. It comes out of that, and that is, and I used to use these masks. I know what I use those masks for, and I mean, these are just the same. So I'm not going to comment on that. We can be a model community. We can be a model community because we do respect the choices of each other. Now, there are rules that we have to comply with. And those are rules that are, the mandates come from orders in council, which are effectively legislation from the province. But the province is the lowest level of authority that creates those rules, and we are legally bound to follow them. So we don't have any real flex room there, and I think all my colleagues would agree with me on this. What we do have is we have the question of how do we work around this? And my answer to that, as it has been for a long time when I worked for the province, I found things that I didn't agree with, that didn't work for the place that I worked in, so I found workarounds. Now, this could be a dry run for who knows what down the road, because there's limitation and there's disadvantage that's being imposed upon us. I disagree with that whatsoever. We can practice looking after each other in ways that we can do it. And that's going to be some of us looking after others, others looking after others, etc. And that's what this community does in a really, really fine way. We're good at that. I think we can practice that here. I am certainly not one to welcome any more regulation than we need. But even I believe this province is trying to figure out what should be done. And I believe there's a lot of people probably doing their best. And we're running into the situation that you described. It's confusing. It divides us apart. When we're divided, we are already conquered. And that is not what I know of this community. So I feel strongly about this. And I feel strongly about the potential for division, for polarization, for us to not be working together. And maybe that's an agenda somewhere, way the hell up, where we can imagine we have an idea what's going on there. But I don't think we've got anything more than that. what I'm saying basically is that there, at one level, I don't think there's an awful lot we can do. But at another level, there's a lot we can do, and that's where I'm focusing. Thank you.
Comment.
So that's a comment. Thank you, Chair.
With a question or comment, Councillor Elliott.
Hi, Michelle. It's really good to see you. I know Michelle well. She worked with my children. I think it's heartbreaking. She loses her job or a situation that is untenable. The idea that the city government has a jurisdictional way of making changes to the law is not correct. Whether people personally choose to follow those laws or not is a form of resistance, as you say. The city of Alberta can't really be tied up in not following orders. Can't be. I think we need to, as a community, be supportive of one another. And I don't agree with every order that comes out, for sure. I think the government could do better at giving fair representation to all of the various statistics and facts rather than focusing on narrowly. We have more than one crisis going on in this province, and we don't get the same amount of exposure for the facts affiliated with the overdose the opioid overdose crises we're in. We also don't get good representation of facts for all other illnesses and hospitals at this point in time. They seem to be very focused. I'm also extremely good at math, so I do know that vaccines are helping. I trust that the public health office tells me the number of tests that have taken place, that they have. I haven't gone down to chase that myself. I don't believe that they will tell me that they have taken place when they haven't. So I'm vaccinated and I'm not afraid that it's going to hurt me. I think it's helping me. I've gotten flu shots regularly in the past for the same reason, because I like to not get the flu and they seem to help me head on. I think that we need to start stopping COVID and not people. I think that the people losing their jobs and livelihoods over this crisis should take it to court. And my heart goes out to you, Michelle. I agree with my resolution.
The handout that I gave gives you graphs on what's happening with the treatments in India. So it shows the treatments, what was happening with COVID. As soon as these lines were reduced, how are you? So that's an important thing to think about as we go forward with any mandate.
So ivermectin, as far as I understand it, Michelle, you can correct me if I'm wrong, is an antidepressant medication. Conditions in India are such that most of the underlying, many of the people in India have underlying comorbidity is affiliated with parasites. So areas where that comorbidity is not the issue, may not have the same results.
And we wouldn't know until we tried.
This isn't an opportunity.
So,
That was debate.
I know, my point is that statistics in India where parasites are high would show a way different story than North America. So just so you're aware of that, that is it's a parasite medication. It doesn't do much for it.
Mayor Formosa, question or comment?
I have a comment. So I'd like to thank you, Michelle, for coming today. It takes guts to get up here and go against the norm. Sorry about that. I want to thank you for coming today. It takes guts to get up here and go against the norm, or just to come and make a presentation to a group like this. It's nerve-wracking, I know. So I want to thank you for that. I also want to say that unfortunately, we can say nice things and such, but this whole issue is pitting family against family, friend against friend, community member against community member, worker against worker, and it just breaks my heart to pieces. Anyways, thank you for coming and sharing your thoughts. It is a free country, it is a democracy, and we're allowed to speak our own will, so thanks for coming.
Thank you for having me.
Yeah, through the chair, I also want to thank you for being here today. As I said in our last presentation a couple of weeks ago, everybody that's sitting at this table represents all of our citizens of Powell River. Our hearts go out to you in your particular situation and many others who find themselves in that same situation. It's Councillor Elliott is in tears here. There's a need for that as well. There's a lot of grieving going on out there. It's not an easy situation. It's very confusing. I'm just hoping that sooner or later we can get a grip on what's going on and we can get out of this nightmare that we find ourselves in. Because it certainly is a nightmare. And when you talk about, the mayor talks about big household again household, my wife and I have this conversation regularly over morning coffee, and there's no clear answers. The one answer you keep seeing time and time on the TV screen is percentage of vaccinated that aren't getting COVID, and the percentage that is unvaccinated, how many of them are in the hospital. Do you have anything to share in that regard?
Yeah, in your package, the information that I'm sharing is from both the Canada Health Alliance and the COVID Care Alliance. And again, these are hundreds of thousands of primarily doctors, professionals who put this data together. They've done so not because it's fun. They've done so at grave risk to their careers and their reputations. They've done so because they themselves have been studying the processes over the last year. So some of the people that are authored in these documents that I've given are very, very, very qualified to be stating the facts that they're stating. So I think it would be well worthwhile to take some time and review that. One of the documents is the Nuremberg Code, and it is talked through. This is put together again by the COVID Care Alliance, and it talks through the details of how these codes apply to this circumstance. And we all need to remember, November 11th is coming up soon, that in Nazi Germany, the Holocaust was legal and was ended.